Good afternoon, everyone, and many thanks for taking time to join this webinar today. For those that I've not met yet, my name is Charmaine Jackson, and I head up the training team for Ardens. And for today's webinar, we're going to look at how we can help you to manage infections and also improve antibiotic prescribing as well. So this is going to be helpful at practice level, but also across PCN and ICB level if you're looking at a way of improving in that area, which I'm sure you all are. Now, this webinar is purely for EMIS practices. So if you are a System 1 practice, you're more than welcome to stay along for the introduction. But when we actually get to demonstrating the live resources, it will be the EMIS system. So it might be a little bit confusing. So for any System 1 practices, your webinar is happening on Tuesday at 1 o'clock, and Amanda is just about to post in the Q&A how you can sign up for that, just in case you're on the wrong webinar today. Now, I have got a team of my colleagues with me today who I would like to introduce because they're going to be helping me throughout the webinar today. So first of all, we have Amanda Osborne. Amanda is one of our training specialists. She looks after the South East and London region, so you may have come across Amanda before. And Amanda's going to be supporting me with the questions throughout the webinar today. So please make sure you do fire off your questions as much as you like. We've also got two of our best practice team on the webinar today, which I'm really pleased to have both of them on today. And that is Dr. Emma Tate and also Dr. Harriet Barrett, who you can see on screen there. They have been the ones that have been driving the new update to our infection resources and also providing you with brand new formularies, which we're really excited to be showing you today. So shortly, Emma's going to be talking about what the update was and why we did it and why it's so important. So I'll be passing over to Emma soon. But before we do that, I mean, you've probably been on so many of these webinars, but just a quick reminder of housekeeping. So you're not connected to a camera or a microphone. We do encourage questions. So if you do have a question, then just make sure you're happy you know where to find the Q&A option, as well as questions. Because these are new resources and updated resources, we would love to have your feedback. So if you've been using the infection resources, they've been out for about a week now, I think, haven't they? So if they've been out already and you've been using them, please let us know your feedback, because that helps us to improve on the resources. So feel free to pop any feedback in the Q&A as well. This session is going to last up to 1 hour. It won't go over that because I appreciate that you're busy people, so we'll keep to the 1 hour. It may finish a little bit early. It just depends on what questions we have. And the session will be recorded. So if you want to refer back to it, you can do that as many times as you like. It never expires. What we will do is we will email everyone that's registered on the webinar today with the recording and the slides as well. And we will make sure it's available on our webinar library too. So just a bit of housekeeping there. We want to make sure that you're getting the most out of this webinar today. Now, in terms of the agenda, I'm just going to let you know quickly what the structure would be, just so you can see what order we're doing things in. We are going to start with a very quick background on the why, the how, and why it's so important. We're then going to go into a live demonstration. So I'm going to be walking you through how to use all of the different resources that is available to you. You can ask questions throughout the whole session, but we will also have an open Q&A at the end. So if you rather verbally answer your question, then you can unmute yourself and you can answer your question that way. And we've got everyone on board to be able to reply to those questions. And then we're going to finish off with next steps. So you know exactly how you can tap into any further training and support as and when you need it. So in terms of a quick background, now we know that AMR is a challenge. We know that as it continues to grow, infections become harder and longer to treat. We know that overall that then has an impact on patient safety, increase in hospital admissions, and also then just puts pressure on the healthcare system in general. So we also know that as part of the NHS longer term plans, they are looking at tackling this area. They have a number of different priorities that are in place, and one of them is around reducing antibiotic prescribing. So last week we sent out in our bulletin, so we do a monthly bulletin every month. If you're not signed up for that bulletin, let us know and we can send you the details. And we stated on there 5 ways that we're continuing to help you in this area. And that's everything from helping you standardize clinical care and making sure that your clinicians are following the latest pathways. We're helping you improve antibiotic prescribing, and Emma will talk to you about that in a minute. We want to also encourage patient self-care, so we're providing you with different resources and pre-texts you could use for your patients. We want to reduce infection rates as well, so we've got a number of different vaccination suites to really help you with streamlining and improving uptake across your childhood, your adult, and also your seasonal vaccination programs as well. And also we want to help you evaluate and improve going forward. So Ardens Manager is our population health management tool. Some of you may be aware of it. Hopefully most of you are using it. And that is there to help you keep track of your performance across primary care, help you benchmark activity, look at real-time information, and really drive that improvement going forward. So what we've also been doing behind the scenes is updating all of our infection resources to help you with this. And what I'm going to do now is I'm going to pass you over to Emma, who's going to provide a little bit more information before I give you the live demo. So over to you, Emma.
Charmaine, hi everyone. I'm Emma and I'm a GP in the best practice team. As we all know, infections are one of the most common reasons patients come to see us, but we recognise that there is wide variation in how they are assessed and how they're managed. So we wanted to build new templates that give us a smarter and more user-friendly way to assess and manage these patients. So Charmaine will guide you through the structure of these templates in the webinar. But the layout of these templates is streamlined with clear traffic light colour coding that helps clinicians to quickly assess the severity and the risk of complications and decide on the right management pathway for that patient. The templates are built using national guidance and validated scoring systems such as Centaur and Fever Pain, which supports best practice decision making. We're also really excited to release the first ever formularies in EMIS. They're designed to support safer and more consistent prescribing. Each template includes a dedicated formulary page and will show you how you can prescribe safely and quickly by pressing F12, which will launch the prescribing protocol. Some of the templates also include follow-up pages to reassess the patient, and Charmaine will show you some examples of these. And because the documentation and the coding is standardized, it supports quality improvement, audit, and consistent care. So I'm now going to hand you back over to Charmaine, and she will walk you through how to use these resources.
Thank you, Emma. And if there are any questions that you need to answer our clinical team, please do make sure that you fire them away as well. So in terms of the live demonstration, I'm just going to give you a live demonstration on what you have available to you right now. So what you can go away with and what you can start using straight away. And that is our templates, our infection templates, and it's also our protocol as well for our formulary. So those are the ones that I'm going to show you today. But do note that we are also working on updating and improving our reports in this area, our searches in this area, and also providing you with a dashboard. So as soon as that is available, we'll let you know via a bulletin. Another reason why, just make sure you get signed up for that. We send an email out obviously to you all, and we will provide you some extra training as well. So what I'm going to do now then is I'm just going to jump into my EMIS system. Just note that the system that I'm using is a test environment. So all of the patients that you see on screen, it's all demo information on there, but the way that you actually use the resources is the way that you would use it in your normal back in practice. So that will all be the same for you. Let me just make sure I've got my right screens up so that I can just show you exactly how it works. Just bear with me. There we go. Okay. So the very first resource that I'm going to show you is our template launcher. Now, our template launcher is a way that you can access all of these useful infection resources whenever you need them. And you can access them anywhere in the patient record, but mostly it's probably going to be your clinicians that are using this, and they're mostly going to be in a consultation. So the very, very first point to take away is to make sure that all of the relevant staff have the infections template launcher on their F12. And the way that they do that is they just press F12 on their keyboard, and what they're looking out for and what they want to add to their F12 is this launcher here, which is Infections Launcher Ardens New. Make sure it has Ardens New next to it. If you're not too sure how to add it, just make sure you have an empty letter or number. You do a right click and then you select the option for add. That will then open up the protocol finder screen or protocol picker screen. And from here, you would type in infections, and what you want is infections launcher Ardens new. So everyone who will be using these resources will have to have that on their F12. So if you're a practice manager or if you're a senior admin person on this call today, just make sure you go away and make sure that your staff are aware of that launcher and help them to add it if they need to. Unfortunately, there's no way in EMIS you can do it at organisation level, so you will have to do it on an individual basis. So once it's on there, you're ready to use it whenever needed. And like I mentioned, it's mainly going to be your clinicians that are probably going to be using it. And more than likely, they're going to be in a consultation at this stage. So patient comes in, they may have a sore throat, they may have a cough, anything that triggers the clinician to want to then run those infection resources. So they're in their consultation. Patients come in with a cough, they've had it for the past 5 days or so, there might be signs of chest pain, so actually I want to make sure I'm following the latest guidance, I'm going to use the infection resources. So at this point, I press F12 on my keyboard, and then I will double click on the infections launcher to open that up. What that will then do is it will provide me, with multiple choice question, and this is just letting me know, okay, what template do you want to access? And we have up to 10 of the infection templates that have been updated with the new resources that we're showing you today. Behind each of these options, for most of them, well, for every single one of them, you'll have a template, and for most of them, you'll have a formulary protocol. So you'll be able to see that when you select the option. Now, an example I'm going to use is acute cough. So I'm going to click on my RTI option. And that will then say, okay, well, do you want to launch the template or do you want to launch the formulary? Now, I want to be able to record my assessment, my initial management for the patient. So the very first step that your clinician would take is to launch the template. So most of the time when you access the infections template, by default, you'll be taken to the acute page. And this is where you're going to start with the assessment, where you're going to be capturing things like the history of the patient, any symptoms they may have, capturing any examination findings, and then going on to do your management, etc. Depending on what the infection is, the pages will vary, but I'm going to give you a couple of examples as we go along today anyway. But if we start with the acute page, remember the whole idea of this is to help you with a structured consultation and making sure that you're recording that data consistently and correctly and you're following that right guidance. So at the very top is where you could use the fields to capture and record the symptoms for the patient. So you would use the relevant drop-down fields. This is no different to how you're already using an EMIS template already. Remembering on the right-hand side, it will tell you what the latest information has been for that patient. You then got the options to record all of your different examination findings. I can check to see what it previously was over on the right-hand side. And this is where you have to make sure you pay attention to this field here, which is your risk signs of complications. And what you're doing in this particular field is you're noting any features or signs of complications for that patient. So are they at a higher risk? Or do they have no complications at all? I have to make sure that I'm noting this because this then forms that clinical impression, which will then put the patient, or you then decide what category that patient goes under in order to be able to complete that management plan. So let's say, for instance, there is no complications for the patient. Just below that, this is where you'll see the traffic light system that Emma mentioned earlier. So I've selected here that there's no signs of complication, so therefore my patient would sit under the green status and I would complete the relevant information. If the patient is showing risk of complications, maybe they're well, but they're showing risk of complications, they'll go under amber, or if they're really not well and they're showing signs of complications, they will go under the red category. And it's just then the case of then recording the right management plan suitable for that patient. So here, if I'm saying that my patient has no complications, I can go ahead and complete the fields that are relevant for that patient. Now, just to note that against some of these fields, you have pre-text in there for you. So this is, again, just helping you speed up that data entry without you having to complete it all the time. But what you can do is you can edit that information if you need to. You can add any additional information. That's absolutely fine if you need to do that. So you go ahead, select all of the relevant information. Here you can type in the actual plan that you've discussed with that patient using the free text field. And if I'm happy at this point that there's no complications for this patient, no medication is needed at all, I can then go ahead, save my template, and that's all of the data then saved back into that consultation. If, however, I've selected that there are signs of complications for the patient, and instead the patient actually sits within amber or maybe the red status, this is where it may generate me, not particularly for cough, but for other areas such as sore throat, to maybe do a referral form. It might mean that for some of these, it will then generate me to actually want to prescribe some medication. And this is what we're going to be covering next. This patient now needs medication. So over on the left-hand side, you will now have this new formulary page. And what this is doing, it's following all of the latest NICE guidance for you. So you're not having to go searching for it anywhere else. It's all in the template for you. And it's telling you exactly what first choice you should be prescribing depending on the patient's age, and what alternatives you should be prescribing because maybe they're pregnant, maybe you need to avoid it because they are pregnant. So it's laying out all of your prescribing guidance for you without you having to go anywhere else. It's all in there for you. So once you've noted that, okay, this patient is 66, they fall under this category here, they're definitely not pregnant, so therefore I'm looking at my first choice, but I've also got my alternative first choice if I need it. I've established exactly what I need to prescribe, and if there are any considerations I need to take in account, I can select the boxes to say that I've discussed allergies with the patients, I've discussed that they're definitely not pregnant, I may want to take their weight, I've got the option for the weight there, and I've got a link to the target RTI if I want to launch that at that stage as well. Now, when I'm now ready to prescribe the medication, I can simply save the template, and that's going to save all of my assessment and my management data back to the consultation. And this is when I can then go ahead and I can then use the formulary protocol to issue my medication. So again, I'm going to press F12 and I'm going to launch the infections launcher. I'm going to go back into the relevant infection, and now I'm going to pick up the acute cough formulary. Now, the reason why I'm doing it this way is because I want all of my data plus my medication to all be under one consultation. You could launch this formulary via the template if you wanted to, so you don't have to save it first. You could press F12 and formulary, but just note that what it would do is it will pop the medication in the medication tab, but it won't put it in the consultations. If you want everything in one, complete your data, save it, then launch your launcher again, and then pick up your formulary. So this is a new bit here. So this is, we haven't had this for EMIS practices. So now you're ready to prescribe. So you would select your formulary. You now know exactly what you need to prescribe for that patient. So I'm going to pick up my first choice, but note there that you've got your alternatives. You can also open up the template again if you need to record any information. Pick my choice. And this is then going to take me through all of that prescribing information safely for me, picking my dose up there. And eventually what that will then do is it will launch the actual prescription screen for me. There we go. From here, do the normal process and approve and complete, and that's done. So that is everything that you need for that infection, all done in a template and a protocol, including your medication as well. It's saved all the information, so it's all consistent. You know that you're safely prescribing. You know that you've got all of the information that you require, and it's all in the consultation for you. Just don't forget, after doing all of that great work, just don't forget to save it so that you can then save it back to the patient's record, and that information will be there. So I'm just going to pause. That's the main how-to on how you use our resources, but I'm just really interested to see if there's been any questions or feedback. So Amanda, anything worth sharing?
Yeah, can we ask, are the formulary pages linked to national or local formulary? Question mark. Is there a way to link to local formulary?
Harriet and Emma, over to you.
So we would link to national guidance and national formularies so that all users are using the same formularies here rather than linking to specific local formularies.
Does that answer your question? Thank you. Can I ask another question? Are these templates for adults and children?
Yeah, so I've written on that one. We specify the age group normally in the subheading of the template, just sitting below the title of the template. And sometimes on the formulary pages, we specify again specific age ranges for various medications. So it's often clear on the template as to what age it's for.
Thank you.
And one more question, I think. So it may be easier to ask directly on camera or unmute, perhaps. Can Dr. Emma evidence-base the use of it's first-line treatment for URTI symptoms in Europe, possibly because it's classed in UK as a herbal treatment, etc.?
I think this is going, I mean, Emma can answer as well, but I think this is going back to national guidance. We're following NICE guidelines, national guidance. So we would, if that becomes national guidance here, fine, we always keep our templates under review and update them, but we wouldn't be able to amend that unless that's within guidance like NICE at the moment.
Thank you, Harriet. Anything else, Amanda?
No further questions at the minute that I can see.
Perfect. Okay, so please keep answering your questions if you need to. I'm going to do a quick couple of more examples just so you can see a few more different pages, and then we'll stop and we'll unmute people and you can answer your questions verbally. So hopefully that's made sense so far. It looks very easy and simple to use. I'm going to save this consultation. I'm going to reopen another consultation because I now have a patient coming in complaining of a sore throat. So this is where I'm going to be using the sore throat template. Again, I'm going to hit my F12 and I'm going to select the infections launcher there. And then this time I'm going into ENT and I want the sore throat template. But note that we've got others that you could be using for different areas as well. So it might be worth, like, once you put it on your F12, just familiarizing yourself with what is available so that you can then share that with your clinical team as well. So I'm picking up the sore throat template. And once it launches that template, again, by default, it takes me to my acute page. Remember, this is where we're going to be recording the history for the patient, the symptoms that they are presenting with. And for sore throat template, there is an additional page for scores. So I can click on scores here, and I can then calculate the fever pain or the Centaur score, depending on what I'm using in practice. So if it's the fever pain, I can then go ahead and complete the necessary information using the drop-down fields. So I'll just pop that information in here. And then from here, I would then total that up and pop in the score in the field provided. And it's very much the same for the Centaur criteria score as well. You've got the option there too. Now, once I've popped that information in, remember we still need to do the management side. We still need to make sure that we're recording that risk if there are any. So we need to make sure we go back into the acute page, and then we've already completed the fever pain score. And I think that's actually important to know that you don't have to do it in both places. If you've already recorded it here, you don't need to put it in here as well. You don't have to use this. This is only if you want to be able to look and calculate the score there. I would pick up my complication for the patient. And then depending on that, I would then fit the patient into the right category. And with this is really clear as well, because based on that fever pain score or Centaur score, this is where the patient will fall under. I think I put, what did I put in there? I put 3 in there. So therefore my patient is going to be in this category here. So again, I would then go ahead and I would then complete the relevant information. If I need to prescribe any antibiotics, then remember I can click on my formulary page that then follows national guidance on what I should be prescribing for that patient, any considerations I need to be thinking about, and then I can then launch my formulary again and then prescribe that medication for the patient. Now, I've been told that referral page is really quite useful for this particular area when it comes to sore throat. So if you are deciding that you are referring this patient on, then this is where you can use the referral page. And here it's helping you to record the criteria for that referral. And what it means then is you're documenting all of this information. And when it's then time to generate that referral form, whether you use another system or whether you use your clinical systems to do that, then all of this relevant information will be pulled through, evidence that the patient has met the criteria for the referral. And again, this is following national guidance at this stage here. You will then use your local forms to be able to refer that patient on. So here you got for the tonsils area there. So again, I can pick out the criteria and also the plan for that patient as well. Go ahead and I would save it. The only other page which is worth noting is the results and follow-up page. So some of the infection templates will have the results and follow-up page, and gastroenteritis is an example. So I've got a patient who's come in experiencing diarrhea. I want to use that gastroenteritis template. So again, I'm going to launch my infection template. This time I'm going to pick up GI, and then I'm going to pick up the template. And look, it clearly states there that this is for adult use. So I pick that up. And then the only difference with this particular template, so you've still got your acute page, you've still got your formulary, you've still got your referrals, but what you've also got in there is your results and follow-up. So let's say, for instance, the patient is coming back in to discuss their results. It might mean that you want to reassess that patient, like Emma mentioned or Harriet mentioned earlier. So from here, you can go in, you can recapture that history if needed, you can recapture those examination findings if needed, and you can also adjust the plan for the patient if needed as well. So again, here's your complications that you can update again, and here's your different categories, which allows you to complete that information. Again, once you completed it, you can then save the template, and that saves all of the data back to the patient record. So that is mainly the infection resources, but it's also always worth noting the analyzer tools that are in the pink box there, because if the patient needs any extra blood tests that may be outstanding, you've got our blood test analyzer, so you can quickly scan there to see whether any blood tests are required for that patient based on the conditions they have, based on the medication they have. You may also want to have a quick scan to see if there is any reasonable adjustments that you need to consider for that patient. So it's always good to have a look at this area here to see whether there is any further care you can complete for that patient right now if it's outstanding, and also it's useful to have any key information for that patient if you are deciding to refer that patient on. And I'll get Amanda to put some links into the support articles for blood test analyzer and patient analyzer as well, because I think that's important for people to know as well. So that really brings me to the end of the live demonstration, and hopefully that's been useful. Hopefully that makes sense. So at this point, we're just going to invite anyone for any further questions. So Amanda, Emma, Harriet, I don't know whether there's been any questions in the Q&A that's worth discussing, and then we can start inviting people to verbally answer their question if needed.
Yeah, we've had one question about whether we recommend antibiotic sparing options, and yes, we will do. If again they're in guidance, we will put them at the top of the template before the antibiotics to encourage use of those. Say like a Tygo for otitis media, and for sinusitis we have nasal saline and steroid options there on the template as well. Looking at other questions come in, I'm not sure if this is answering, there was a question saying, will the template show the course of antibiotics prescribed previously in the last year? We're certainly developing reports at the moment to enable clinicians and users to look at antibiotic prescribing for specific conditions, so you can audit the use of them. Then just going through the other ones. Is there a template for COPD acute exacerbation? It hasn't been one of our first, we've released 10 in this set of infection templates, so it hasn't been one we've refreshed in this set. But I'm not sure if Emma, if that's a resource already available on EMIS, but it's certainly not one we've refreshed this time.
We do. We have a COPD template, and we've got an exacerbation page within that. But as Harriet said, it's not been part of this refresh, so it hasn't got all the traffic light system and the formulary associated with it. But certainly, we're looking to develop a lot more infection templates. And if this is one that we agree that is a good one to do, then we can put that into our phase 2.
Looks like we've had a question around that. Probably looks like a clinical question. Will prescribing take into consideration things like kidney function, pregnancy allergies, warfarin and other drug interactions before doing the suggestions.
Yes, so we've certainly got the considerations at the bottom, which would take into account things like, as I said, allergies and pregnancy. I think when it gets complicated, when there are other comorbidities like CKD, then it does obviously depend on clinical judgment, and they'll need to sort of use other resources like the BNF to check the guidelines specifically on that. But we've certainly the pregnancy and sort of age and other considerations are included in the bottom. Yeah.
Emma. And does it allow delayed or backup prescribing?
It does. Yes. So certainly some of our amber categories, the guidance suggests that you either do no antibiotic or consider a delayed prescription. And so we've got that as an option where it's appropriate.
Okay, brilliant. We've got quite a few. This is good. Any more questions? Just keep firing them away. This is really good.
There is another question on there, Charmaine.
Go for it.
It says a bit of a statement. Is not coding the problem like tonsillitis or cough?
So we do have codes underlying, and we do have a tonsillitis code on that page. So it's cough, it should code acute cough code as well underlying, but for the tonsillitis one we do have specific codes as well, including I think recurrent tonsillitis as well there, because we know that's really important when you're deciding whether patients need a tonsillectomy, and in order to be able to search those codes effectively.
Can I keep asking the questions?
Yeah, go for it.
Go for it. Does it support shorter is better or default to 5 days where appropriate?
We will always follow guidance, and that is decreasing antibiotic prescribing to the shortest duration as possible where appropriate. So that will always be our first go-to, is the shortest duration. Recently, we've reduced our pneumonia prescribing down to the latest guidance as well to 3 days for children. So we are constantly keeping up to date with any changes to reduce antibiotic use.
Certainly in the formularies, when you're actually sort of within the protocol, the prescribing protocol, certainly where guidance says between 5 and 7 days, we always have a 5-day option as the first one, as Harriet says, but you have got the option to click on a 7-day or a long course if that patient needs it. But the option is there with the shortest first always.
Are there target leaflet links in all templates where possible to support self-care?
Yeah, we didn't show the resources page, did we? That's my mistake. So yeah, we've got the resources page here, and this is where you can find links for what you mentioned there for the target ones. You've got the patient info there as well, professional links. So really useful resources on every single one of those infection templates. There's the resources page, isn't there? So yes to that question.
I think we do have another question.
Amazing.
We have, bear with me. Sorry. So about my question about showing other courses of antibiotics prescribed, would you see this information for a particular patient when using the template, e.g. to show risk of resistance?
Sorry, which question is that?
I think
trying to find it.
I don't think you'd see it on your template. You'd have to go into a medication screen to look at the previous.
I think that's it. The recording will be ready in a couple of days, Charmaine, is that correct? And we send it round?
Yeah, I'll try and get it done later on so that you've got that, so no problem. Fine, so should we invite anyone who may want to verbally answer their question? We may have answered a lot of the questions already. If you do want to verbally answer your question, if you just raise your hand just to let us know that you want us to unmute, and then we can unmute you. But no pressure. If you'd rather not and you rather just use the Q&A, then that's absolutely fine as well. We've had a question come in while we wait for hands to be raised.
What is the difference between patient info and target treating RTI?
Patient.info is a website, or Patient UK. It's had a few names, I think, but that will just take you to that website with the appropriate, the sore throat patient information leaflet on it. Target leaflets are specific ones developed by by Target, who are the Antimicrobial Stewardship they do all the leaflets that look at specifically self-care and specific antibiotic information. So it's worth having a look and just playing around with it and seeing what information they are. But the Target leaflets are brilliant. And there's also a specific Target leaflet you can give when you give a delayed script. And actually on our considerations part at the bottom of the formulary page, there is actually now a SNOMED code that can code that you have given that leaflet with a delayed script, so which is brilliant, obviously, for when you're auditing the antimicrobial use.
Amazing. Got a hand up. So good timing. Calvert, I'm just going to allow your microphone. So fire your question away. You can unmute yourself now. It's Calvert from Merrow Park Surgery. Go ahead, you can unmute yourself.
Sorry, there we go.
Right.
I'm unmuted. Thanks. This is a really helpful webinar. I've already uploaded the launcher on my EMIS as I'm looking at this live. So yeah, the resources are really good. So this is going back to my pelargonium question. So the NICE guidance says that we should offer self-care treatments, honey, pelargonium, over-the-counter cough medicines. So the link that's done on the launcher mentions honey, and then it says over-the-counter as a kind of a generic group. But actually, the NICE guidance is specifically to mention pelargonium. And my reason for raising this is it seems to be a massively underused resource. The RCTs seem to suggest it reduces symptom severity, duration for common cold, sinusitis, cough, otitis media, flu. There's in vitro evidence for COVID. Only thing it doesn't seem to work with is laryngitis. Anyway, it's just, if that was I think from an NHS perspective, I have no reason for pushing this. I haven't, there's only one manufacturer. I have no links with them, but it seems to be massively underused. That was all.
I think we'd be very happy to review this. If you wanted to, I can put a link to the email for our email, and we could certainly review that in more detail. That'd be fine.
Yeah, presumably my email details come up on the chat. So great.
Yeah.
Thank you very much.
Thank you for your question. Any more questions? We had another question in the chat, haven't we, Amanda?
We have. Would the template prompt prescriber to consider sending samples for sensitives when appropriate?
Yes, so that would be, yes, certainly on the consultation pages when the clinician is reviewing a patient, it will prompt when it's appropriate to send a swab or an MSU and code that appropriately. And then you would be able to see those results quite nicely in a view kind of format to see what previous culture results have been, so you can prescribe accordingly as well.
Thank you, Harriet. Any more questions? While we're waiting for some questions to come through, I will pop up this slide. When we share this slide as well, we're just giving you examples, screenshots of what it looks like for each of those areas as well. So we will share these slides because it might be useful prompts, but just make sure you do go away and you pop on that template launcher, and that will then give you access to everything. So while we wait for some more questions, if there are any, and it's been really useful to see the questions coming through, so thank you. If you do require any additional training and support, then training is absolutely free for Ardens. So we can deliver this at practice level, also PCN or ICB level if you think it's going to be useful for your area. So you can scan that QR code and that will take you to all of our different training services that we offer, from Ardens Academy to support articles to book your actual training as well. So please make use of that, particularly if it's practice managers that have joined and you want us to give you more support in encouraging your clinicians to maybe use it, then we're more than happy to do that. So that's a QR code there. So I'll just leave that up for just a second while we wait for any more questions.
We've had one more question. So similar to what Calvert said about OTC, but with saline nasal spray, recent RCT might be the same when Calvert is talking about.
Is this for the sinusitis template? Yes, as I said, we do have saline as an option, a first line option there, instead of using antibiotics, if appropriate, if clinically appropriate.
Thank you.
Thank you. I think that's all the questions. So that has been really useful. Thank you everyone for posting your questions. Emma, Harriet, Amanda, anything further that you want to add before we kind of end the session today? No?
Good,
thank you. So I'm going to leave this last slide here. If you can take time to complete the feedback form, we're really happy, not just about how the webinar went today, although obviously we always love to hear that as well, but also about the resources, because they have been updated. We have those new formularies, and it would just be really good to hear whether you feel this would be useful. Even if you want to just pop it in the Q&A for now and we can see that feedback on the Q&A, that would be brilliant. But we really appreciate your time. Hopefully you found this really useful. Just note that from the new year, we're going to have a lot more clinical focus sessions as well. So do watch out for those too. Any ideas of any webinars you would like to see in the future, let us know. But until then, thank you so much. Thank you for joining. Have a good day, rest of the day, and we'll see you on the next one. So thanks everyone. Thanks for your time.